Can you manage? Can you cope with what's coming your way?
All Sudan, we have maybe less than 500 ventilators.
Please, 1 meter away.
Our Malian population, we do have less than 60 respirators.
It's just sad.
You know what's going to kill many people? Corona is not going to kill many people. It's the hunger that will kill many like you.
It's heartbreaking.
If you were to ask an expert to pick a continent where the coronavirus could do the most damage, he or she would probably say Africa.
There were no ventilators, no ICU staff, no ICU nurses, no anesthetists.
But here's the thing. The continent seems relatively unaffected by the virus so far.
Vele thina sizosithola ngoba asinakekekekile la ema-hostel. Kungcolile kubuka nje buka amalokhuzana ama-drain astakile yonke into udoti ugcwele yonke indawo.
Telling people to wash your hands frequently, and they are all going to a pump crowded there, and that pump is getting dirtier with more people being there, and they don't have money for soap and or extra buckets or kitchen towels.
We've spoken to medics around the continent who say the countries where they live and work are not prepared. There are tens of millions here living in communities that lack basic facilities like clean water. How many ICU beds do you have access to?
In my part of the world,
Yeah.
none.
And as for those specialist intensive care beds and equipment like ventilators, well, there aren't very many to go around.
They do not have even ICU facilities to deal with just one patient. We had stories of ventilators being borrowed from private practice, no plugs in the isolation centers.
That's why there are people here who think Africa will be overwhelmed by the virus.
So we are trying to do our best. I'm telling you, we had a disaster like what is happening in US, United States, and Spain and Italy. I think it will go very bad here.
Please, 1 meter away. Do this, Ceci.
So there's two people are very, very, very sick, and they are going out now.
COVID-19 has been detected all over Africa, but the numbers of those infected just haven't skyrocketed like they have in Europe and the United States.
Over 15,000 coronavirus patients have now died in hospitals across the UK.
In Spain, the total of confirmed cases there now stands at 18,056.
Take this country, South Africa, for example. They've only recorded a couple of thousand infections, despite the fact so many people live so close together.
You've got a one-room house that has about 6 people or so. So it's still the same. You can't have 6 people stuck in one room for the whole day.
If I'm infected, maybe this man is not infected. I'm spreading the virus to the people.
Scientists aren't really sure why the numbers are so low, but they do have a couple of theories.
I want to take a moment to highlight Africa.
First, we may not know how bad the situation is here because African countries haven't done that much testing. The WHO is saying, test, test, test. Can you get a COVID-19 test in the community where you're based?
The nearest one that I was informed as of yesterday was in the capital, which is about 14 hours drive away.
In Nigeria, with a population of 190 million, they've only managed to test a tiny proportion of people. Then there's the fact that Africans are generally younger. The average age here is 19, and COVID-19 tends to disproportionately affect the old. And thirdly, there are some people who think that mandatory injection programs for things like tuberculosis may be slowing the virus's advance.
Through a general boost of the immune response, they can protect also against other types of infections.
Over the past century, the BCG vaccine has protected tens of millions from tuberculosis, and some scientists think it can be repurposed to help control COVID-19.
It could be a very important tool to bridge this dangerous period until we have on the market a proper specific vaccine against coronavirus.
This sickness is a serious disease. People are dying, so we are taking it serious.
Some countries in Africa have been in lockdown for weeks, despite the low number of cases. But that brings its own challenges. The security services stand accused of violently and indiscriminately enforcing these shutdowns. Fumani Umbele says he was whipped by officers in his own garden.
Umzimba wami usabuhlungu nanokuba buhlungu indlela nje engashayeka ngayo angazi noma mhlawumbe khona imbambe ezathinteka angazi kodwa nje angikho right.
And hunger is driving people out of their homes.
It's hunger, it's not about corona now, because you need to survive.
The old people are here. They're starving. They just collapse here because no food.
Dozens of shops and supermarkets have been broken into over the last week.
Instead of emergency that everyone should stay in and quarantine themselves, then how you expect them to be fed?
It's not a question of if the infection rates across Africa rise. It's a question of when.
We are hoping for the best now, but we are preparing for the worst.
You know, people here, they just can't self-isolate. You're not going to stay inside if you share a shack with 6 other people.
Not easy at all. Not easy at all.
And you're not going to stay home if you don't have anything to eat.
You're not going out for a lot of our families. It literally means no food for the family. And they need to at least go out to get water. So, it's kind of like, what would you rather do? Be infected or starve? That's why the experts are so worried. The people of Africa are vulnerable to the coronavirus, and their governments lack the ability, I'm afraid, to treat them when they're sick. It's indescribable. It really is. It's heartbreaking.